An example of a young woman who was injured in a basketball game and actually had knee surgery. When you first start therapy, you're going to be in this downstairs level where we're using heat, ice, electrical stimulation, and she's just received those. And now what we're going to be doing is some stretching with her. So first I'm going to just bring her through some simple range of motion, because initially when someone's injured, the first thing is pain and swelling. Those areas are two problems we must address. Then what we want to do is to try to restore the motion. And again, just through some simple range of motion, trying to stretch the person a little bit more each time. And then giving the person some home exercises that they can do, which will enhance their range and strength as well. How's that feeling, okay? Okay, good. Okay, now this time I'm going to hold it here. All right, just let me hold it, good, and then relax. Let's let it come down nice and easy. Good, so now what I want to do is, now that we've loosened up the muscle back here, I want you to keep your leg straight, and I want you to try to lift it off the table, and I'm going to help you. So try to lift your leg up. There you go. I'm going to try to stretch it for you a little bit more. We want to get it up about this high. And then we're going to let it down nice and easy, and I'm helping you. So you let it go all the way down. Okay, and I want you to go all the way down, let this muscle completely relax. So let your leg relax. There you go, good. Now let's try to bring it up again. Okay, try to keep the knee straight. Lift it up. I'm going to give you a little help there. Good, good. And you're going to see in a week or two from now, you'll be doing this all by yourself. Okay, let it come down easy. Great. Okay, and let the leg relax. So now that you've been coming for therapy and the knee's starting to move a little bit better, I know that you're still wondering why you're still having some of that pain. And what I wanted to show you, this is a knee model. Okay, this is what your knee normally looks like. This is your kneecap here, and we're going to be able to flap this away. But what happened with you is that this meniscus, this cartilage, you know, got torn. And that's why when they went in and did the surgery, they had to shave some of that away. So that's why the area is still tender to you in the joint, okay? You still feeling that pain in here, all right, that will go away as more time goes by and the healing continues, because when the knee moves, that as a shock absorber. Now for us to get you back to basketball, just imagine you jumping up and down. This cushion, this pad in here, is what's going to give you relief. And that's why we want to get the muscles strong around the leg, because that's really what's going to protect the joint.
I need to verify physical therapy benefits. Okay. Open access, okay. Okay, so there's no deductible and 60 visits per calendar year. Okay, is any referral or pre-cert needed? Sometimes a patient will call up and say that they don't have their insurance card yet. So we basically ask them, well, you have to get your insurance information for us, at least get the ID number and the effective date for us, and a phone number to the insurance company so that I can call. We have something to go on. And then we can wait for them to get their card, and we'll make a copy of it and keep it in the chart.
Well, I have an 8-year-old son now, and we're able to go out to the park. We're able to go to just almost anywhere without feeling that I'm in pain. I have to carry medication to take. You know, we play games, just a normal life that you would normally do with an 8-year-old child. I love dancing. I do lots of dancing now, where before I wasn't able to do that because raising the hands and just any kind of movement with the hand and shoulder was extremely painful. So now I am doing just about anything that a normal person would do.
The service from DeVita and Becker is outstanding. I've never met such a group of professional therapists as DeVita and Becker. I was in surgery a couple of years ago, and night and day. They treat you wonderfully. I mean, their main concern is to give you primary care and treatment and get you on your road to recovery.
I feel that I'll finally be able to get back to normal walking, just without the pain. It should be great.
I think one of the key things is education. And the one thing about you know, coming for therapy is that as therapists, we know about the body, we know how things heal, and we also know how to take you step by step. So I think that one of the things that we do as therapists is we really will educate you. For instance, you know, people who've had a total hip or a total knee replacement have no idea of what they can do and what they can't do. And we go over the precautions and how you, and what questions that you might want to ask your doctor when you go back, you know, for your follow-ups. Also, when are you able to, you know, climb stairs? When are you able to return to driving? Those kinds of things. The other thing is you know, I'll take a case of an infant. When we work with an infant, really, I would say half of our treatment is really educating the parents, and we usually try to have the mother and the father come in. So this way, whatever we talk to the parents about, they can then reinforce this at home. Something as simple as changing the side of the crib that the baby's going to be facing so that the baby is looking to the side that the weakness is versus the strong side. So something like that may seem very simple and routine to some people, but when you're in the situation, you don't see it. And that's what one of our expertise is, to be able to look from the outside in and then kind of take you and teach you the same, give you the same knowledge that we have. Another thing that I think is really important to maintaining fitness and health is really exercise. And you know, when people say that, they're worried about going to a gym and spending an enormous amount of time working out. I'm talking about just 5 minutes of exercise, meaning we would go over 4 to 6 exercises with you that are going to focus on your problem. So if you had a shoulder surgery, we're going to teach you things that you're going to be doing mainly with your arms or your shoulders that you can do, and it's going to take 5 to 10 minutes in the morning. And initially we want you to do it at least twice a day. So you'll do 5 minutes in the morning, maybe 5 minutes at night. But what I tell people is after your therapy's over, a way to just maintain some good health is to maybe do those exercises anyway, once a day. If it takes you 5 minutes, I mean, you spend time brushing your teeth in the morning, you spend time getting dressed, and doing things like that become routine. The same thing with exercise. 5 or 10 minutes of exercise every day will really make a difference in just how you feel and even your own energy level. And last but not least, along with exercise, you know, comes nutrition. And as therapists, you know, we want to try to guide you on some of the healthy things that you can do. We want to educate people about disease processes like osteoporosis and things that are preventable. So by us educating you on how to eat better and how to, you know, kind of lead a healthier lifestyle, we can hopefully, you know, make a positive effect in your future and hopefully prevent disease processes from happening.